Hey guys, it's been a while since I've gotten on here, and I haven't meant to been away this long, but I definitely wanted to come on here and chat with you guys tonight. Hey, this is Sean, aka the Savvy Business Chick, making sure you know your purpose and destiny in the marketplace. And I am so excited to be talking to you guys on this May Day, May the 1st. But first, before we get started, let me know where you're watching me from. Put it in the comments where you're watching me from. And then, if you are existing home care business owner, give me the number one. And if you are an emerging home care business owner, give me the number two. Tonight, we're going to talk about some common pitfalls in your home care business, whether you're getting started or you've already started. Tonight, we're going to talk about some common pitfalls in your home care business. Common pitfalls in your home care business. So I'm going to wait for some of you guys to join and put in your hearts. Hey, how are you?
Hey, Steve, what's up?
I'm trying to make sure I'm looking on this side. Let me know where you're watching me from. Let me know where you're watching me from. Put it in the comments. All right, I can get my other phone to see how you guys see. Well, make sure it's not a delay because when you're talking to you guys, and I want to make sure it's not a delay. All right. Marilyn, hey, how are you? Okay. Thank you so much for the hearts. We definitely move better when we have some hearts up in here. Okay. All right. So if you are already in business, like I said, give me number one. If you are excuse me, if you are inspiring home care business owner, give me number one. If you are already in business, give me number two. And I'll talk about some common pitfalls in your business. And today I had 3 calls for my free calls that I take on Thursdays that really stood out today. These calls really stood out today. And not necessarily in a great way. So they kind of stood out. And that's why I wanted to talk about the common pitfalls in your business. Hey, Minty, common pitfalls in your business. So when I get like 2 more people to tell me like where they're located, then we'll start. We'll start. I want to make sure you guys are here. And I won't be before you long. Let me know where you're located. Hey, Pennsylvania. Hey, great. Thank you so much for the gift. Let me know you're located. One more person. Let me know you're located. Okay, Florida. Okay, so for those of you who are just joining for the first time, my name is Sean, aka Virginia. Yes, I'm in Virginia. The Savvy Business Chick, making sure you know your purpose and destiny in the marketplace. And on Thursdays, we have calls where we do free calls with people who are at different stages in their home health care business. And my mentee in Virginia that's on TikTok, Renita, you're gonna really, really appreciate this one. I almost wish I could bring you on, but I'm sharing this one part with you guys because I feel like this is a good, valuable lesson. So on Thursdays, I do free initial calls with people, and either they're trying to learn a little bit more about me, because you guys are always saying there's scammers out here, right? And starting a home care business is a big investment, so you want to, make sure that you are, choosing the right mentor. And so I totally understand that. And then some people just have questions. So in this particular event, this young lady who has a skilled home healthcare agency in Texas, she came with question, right? And so I don't mind. She had like a very specific question because um, she needed to get her survey. So I said, well, what kind of business do you have? I said, in Texas, you can be a PSA, personal service agency, or, oh, thank you so much. You could be a personal service agency, or you could be a home health agency. And she said, well, we do both. And she said, well, we're trying to get our survey, but we need a skilled client. So what she said is absolutely correct, right? So in her state, if you get licensed, and her state is Texas, you get licensed first, and then they let you start operating your business. And then essentially, and Georgia does this too, they want you to contact them after you've gotten a client. And then they're going to survey you. Now, to me, that I prefer getting the survey based upon my policies and procedures versus getting the survey on the client and to see how well I do with the client. And I'll explain why. So she said, well, at first, they contacted the state and said, hey, we're ready for a survey, aka letter of readiness. You have to tell them when you're ready so they can come out. And so then the state reminded her and it's like, well, because you're listed as skilled and unskilled, then you actually need a skilled client. So she kind of rushed to get a skilled client, but here's where she literally fumbled the ball. Hey, Samantha on YouTube, let us know where you're watching from. So my mentee on TikTok, she is a nurse. She is a skilled nurse. And the person I was talking to is not a nurse. Now, don't get me wrong, you do not need to be a nurse to start a home health care agency, a skilled nursing agency. I myself is not a nurse, never went to nursing school, and owned a successful pediatric focused home health agency. So don't get me wrong when I say, she fumbled the ball on this, but this is what happened. So the client had some kind of surgery, was leaving the rehab, and needed skilled care. The skilled care that the client needed was PT, OT, skilled nursing. A lot of times these services come combined like this. Right? So when you're in the skilled sector, if a client is coming out of a facility, I want you guys to put yourself in the mindset of these situations. They're in a facility. In rehab, everybody is there. They get a visit one time a day from PT. They get a visit to make sure they can walk and be able to go to the bathroom. Just a clear example. They get another visit from OT, to do like the upper body regimens. They get a visit from nursing for the medications to dress a wound, blah 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 blah, and then they get a visit from the the other care team, right? The bathing, right? All the other things. They're getting so much in the facility that when they're sent home, their first couple of days, if they're still at that acute level, then essentially they want to stay. They want to keep them with that many what they call disciplines, that many people coming to meet their needs. Now, this particular client, from what she told me, had a wound. And so she did not go into detail about the wound, but that just kind of sent a big red signal to me because the client had a wound. Yeah, it's round-the-clock care. And yes, thank you, Nurse Jordan. Exactly. So we have another nurse on here. Thank you, Nurse Jordan, and then my nurse Rita. Now I want my nurses. Let me see. I'm gonna have to bring my nurses up here. Okay, I'll figure it out. Okay, so and I'm really not trying to go so slow on this, guys. Okay, so correct me if I'm wrong. To my nurses that's on here. When you leave a facility, you get discharge orders. How long do those discharge orders last for the home? Right? Because her discharge orders were for wound care 3 times a week, right? Skilled nursing, medication, right? She had a medication regimen, and then she had the OTPT, right? And so, and the kind of questions she was asking me, I was just like, okay, well, when did you do the initial assessment? And so she said, well, the client got discharged on Friday. We did the initial assessment on Friday. Now, from what she was telling me, my nurses, do you mean when is the earliest visit? So, yes, what she said is that they went when the client got discharged home on Friday, they went to the home to see the client there, right? And I might bring you up. I'm trying to figure out you guys up, right? So she went to the home, right? And so she's saying that her nurse, and she's calling her DON, did the initial assessment. And so what's not adding up here, guys, is that an initial assessment, it does not sound like she did a head to toe assessment. Now, I'm not a nurse. I got some nurses up here who can, I'm trying to, because I haven't been on TikTok in a while, I'm trying to figure out how to do my my, my invitations. But with that being said, um, I said, well, in your initial assessment, did your DON, do an inventory of all of the equipment that the client had, all of the supplies? And she was asking me questions like, well, who buys the supplies? Because we've had to buy the supplies for the client. And I said, well, why weren't the supplies, documented? Because if the client is supposed to get wound care or dressing changes 3 times a week, then the nurse that did the initial assessment or the DON should have said, looked at the supplies that were given during discharge and said, okay, this is not enough, so we're going to have to order more and request that the primary care doctor or the doctor that was discharging the client from the facility, increase the volume for home care so that at the conclusion of when the wound is finally closed, that there is enough to do these dressing changes. And I'm telling you, all of this stuff was going over her head, over her head, over her head. She was more focused on, well, who pays for it, because we just found out that the client has a deductible. And I was like, well, what did that have to do with you doing what you're supposed to do during the initial assessment? And so what she told me is that the DON did not do any of that. So what it sounded like, guys, is that all they did was go to the house, meet the client, and get them to sign the service agreement. But she got that service agreement, and I said, well, what form did you use for the initial assessment? She said, form? I said, yeah, what form did you use? Now, in an initial assessment for a skilled client, okay, so for a non-skilled client, an initial assessment is head to toe, right? Head meaning cognitive, what's their mental status, right? Do they, are they confused? Mental status would cover if they have dementia, head to toe. In skilled home care, home health care, your initial assessment is by system. What's the skeletal system? What's the neurological system? They're by systems. And so there should be an assessment that goes over the systems. Let me make sure my RNs, let me see, make sure. Oh no, the insurance. Oh no, the insurance. The client should come home with enough. And yep, starter care should order more. Exactly, Nurse Jordan. Exactly. Like I said, I wish I could bring you guys up so we can talk. Yes. Now, only reason why I was telling her this is because, if you guys don't know, I am not a nurse, but my mentor was a nurse. And so because my home healthcare agency was nursing, skilled nursing, I had to say, okay, she thought that so as of tomorrow, the client would be home for a week. I was like, those discharge orders are no longer functional. They're no longer functional. What your DON should have done was taken those orders, right? Contact the primary care physician or contact the specialist that did the surgery, right? And then compose a plan of treatment. The plan of treatment includes nutrition, it includes equipment, it includes supplies, it includes the actual order for, how many hours of nursing care, how many times the wound will be, the wound dressing is changed. And so essentially they just took the discharge orders and they just started doing stuff. And I was trying to figure out, well, how did this RN, this director of nursing, just go with that? How did she just go with this? This makes no sense to me. I was getting very confused and very frustrated. I'm telling you, this 10-minute free call turned into a 26-minute call because I was just really trying to help her out. But here is the pitfall, right? The person that contacted me, her biggest thing was, well, the insurance said that this lady had a copay. She had met her deductible. And so they were just like, okay, so we may just end up having to provide service to her pro bono. I'm like, okay, that's the least of your worries. And so she said, but we needed a skilled client. And I said, well, sweetie, I understand that you need a skilled client, but here's the thing. You need a skilled client for your survey, but you are literally about to fail your survey because your paperwork isn't right. Like when the state comes in and asks for that file, they're going to ask for the initial assessment. They're going to ask for the plan of care. Like I literally just said, I don't know who did your policies. I don't know who helped you, but please go read your initial assessment policy. So do you have one? Yeah, I think I have one. Please go read it. Right? Because that's why your RN had to come. It's supposed to get signed off, right? It's supposed to get signed off. She's not just signing off on the service agreement. And then why wasn't there a plan of care created, right? And she was like, what is that? What is that? And I'm like, yes, you need the doctor's orders, but your nurse is supposed to take those orders and say, okay, if there is dressing change 3 times a day, then we're going to do it 3 times a week, and we're going to clean around the area. Like she adds that extra thing to it. Okay, while we're doing it, it says use this medication, and we're going to clean the area with antibacterial something. Like she lays out the rest of what goes with it. It's almost like, okay, well, you bring in the beef brisket to the cookout. Okay, yes. And to pair with that, we want this. And what I was hearing to all my nurses and even to my non-nurses, please listen up. Because you would trust a clinical person blindly, thinking that they know what they're doing, when this will get you in trouble. And I tried to share with her. I said, look, I know you want this skilled, I know you want this skilled client for your survey, but what if this makes you fail your survey? Let me go look. Let me go look. Yes, head to toe assessment. Yes. Did they do a care plan? This sounds scary. I'm just reading your comment, Nurse Jordan. No, they did not do a care plan. That's what I'm saying. I'm throwing out these terms to her. I even said, I said, can you go look up this form called HCFA, HCFA 45? I said, look it up. I said, you may have to pay $20 or something like that to download it. I said, but look up this form. I said, have your nurse fill out this form, right? Because at this time she didn't tell me they're using the software. I don't imagine they're using the software, but there is no care plan. There is none care plan. And I said, do you know that the most common, even on the non-skilled side, the most common plan of care policy says that there needs to be one established initially, and then it needs to be updated when there's changes of conditions with the client, and then at the very least annually. You mentioned for California, yes. Was a consent form signed? From what she told me, the only thing that was signed was the service agreement. So I think she's kind of mixing. I think what really threw her off is that she has the non-skill side. And this is a tricky thing in Texas. It's kind of cute, but it's still weird. Okay, so make sure. In Texas, they have the PSA, Personal Service Agency, and that's the non-skilled. Then in Texas, if you want to be a skilled agency, they'll let you be a home health agency, and you can provide skilled nursing, right? RS LPNs, right? And that will allow you to do the skilled level of Medicaid and even go after uh, private insurance, which this one was a Blue Cross Blue Shield, I think. So lastly, the last step is that you can tell Texas that we want to be a Medicare certified home health agency. They'll let you go all the way. So it looks like she's just a personal service agency and the home health agency. And because of that, she's just trying to pass her survey, right? She's trying to pass her survey so she can get an official license. But here is the scary thing about that. Here's where I'm talking about common pitfalls. A lot of times you guys may have someone help you with starting a home care business or home health business, and you just like blindly just like say, okay, whatever you say, and you don't even take the time to read your own policies, read the regulations. I just told some of my mentees in my home care Kickstarter program, I said, go read the regulations. Even if you don't understand them, just read them through. Take a chunk, like take 2 pages today, then take another chunk. Just read through. Pro bono clients don't count. Most states will survey on billable clients. They, I think what she meant was that because the client did not meet their deductible, some of the care they were going to have to provide pro bono. Okay. And yes, I said, I think this is the downside to the agency that do all the paperwork for you, because some people, yes. Did she really understand the discharge order? I don't think so. And here's the thing, guys, she's the administrator. She's the owner. That's why she's contacting me. She's not the nurse. She's not the nurse, right? And so because she's not the nurse, we're on the phone and she's like, well, the paperwork is this. I'm thinking like, girl, I can't even read what you're talking about. And I was just like, that's not helping me. That's not helping me. And like I wasn't even like trying to put like I like was late to like 2 calls because I was like, please, please, please get this, please get this, please get this. I was just like, it sounds like you should not have taken this client. And when I told her she should not have taken this client, it was almost like, well, how can you say that when I need a skilled client to pass my survey? And I said, but did you need this one? Because this one may make you fail your survey. So I think she just really didn't connect the dots between needing the skills applied to pass the survey. That because there are so many things that she missed with this one, that when she gets the surveyor can just be like, okay, this is wrong, this is wrong, this is wrong. So no, I don't understand. I don't think she understood the discharge order. And furthermore, guys, she did not know that the discharge order, and I have to look this up. And if any of my nurses know this answer, but I thought it was 3 to 5 days that a discharge order, you can use a discharge order when the client is discharged home. After that, you have to go out and, get your official in-home orders. And that's the term I kept telling her. You need in-home orders. In-home orders. And for those of you who are following, type in-home order in this is our word of the day. In-home order. In-home order. Yes. Sound like it. Sound like it. Yep. Sound like it. Have the money to pay, but not the care to make sure it's right. Yep. Yes. Yeah. Yep. She should have picked something simpler. Some administrators think they don't need to read or understand their regulations. Absolutely. Medicare wants clients seen within 48 hours. This one is not a Medicare client, but yes, this one's not a Medicare client. Hey, I absolutely love you, and I'm in Indiana. I've been looking for a few years how to start a spa in Indiana. Watch the first minutes of your Indiana, and my app is almost done. Let's see. Okay, great. Congratulations. Do you have to gain a skilled private pay client to get a Medicare surveyor to come out? That's kind of like two different things. So, um, where are you located first? Where are you located? Tell me a little bit more so I can. Ohio. Okay, so you're in Ohio. And did you register your business as a skilled agency, or did you register as a non-medical? You did register as a skilled agency. Okay. Now, have you gone through the Medicare credentialing process? Okay. Have you gone through the Medicare credentialing process? Have you contacted CMS? Have you shown your financials? Okay. So they're going to come out after they approve your policies and procedures. We're talking about Medicare now. So getting licensed is one thing, guys. Being Medicare certified, which is the question I'm getting from TikTok, is a whole different, a lot of times that will include accreditation, right? You have to be accredited, and then you're doing your financials and showing your financial solvency, and then you're doing your policies and procedures. And so what the question is, do do you have to gain a skilled private pay client to get Medicaid surveyor to come out? So they will ask you, sometimes they can ask you for 5, for 3 to 5, right? They want you to admit on the Medicare side, there's a lot stricter. They may want you to admit 7 clients and have 3 active by the time you get your survey. Okay. Okay. I have a PCW agency that's licensed in Wisconsin. Congratulations. Yeah. Medicare is a doozy, guys. That's why no, you can't accept Medicare. Medicare certified agencies are skilled agencies. But guys, the new thing, which is good, because I've been meaning to share this trend that previously, when President Trump was in office, when he was 45, number 45, I have a brother that doesn't even, who just calls him his number. Yeah, 47. And so, long story short, he attempted to do the same thing with, shaking up things with Medicare, right, and Medicaid. And what happened is that it increased Medicare Advantage enrollments and increased Medicare Advantage enrollments. And we talked about this over a year ago, that Medicare Advantage is it's almost like a Medicare MCO or Medicare HMO, where if you are a non-skilled home care agency, you can apply to become a provider with them, and that you get a better paying rate than even Medicaid. So because that was the previous trend, we're looking at I like to follow trends. I'm not an economist, but in our industry, we have to follow trends, guys. We have to look at things and see where the money is flowing, right? So instead of us operating out of fear, we need to say, okay, if this happened before, then this is what will happen this time, right? So, and that's how we make what's called the pivot, right? People pivoted during COVID, right? So, sure. In short, applying for Medicare Advantage, thank you so much, is per state. Per state. Every state has a Medicare Advantage company. Let me see if I can. Let me give you that as an example. Mm-hmm. Let's see. Mm-hmm. Okay. I'm gonna try to just share my screen real quick and see if you guys can see this. So you're not gonna be able to see but so much TikTok because of how things are set up. Okay, so every state has, and as you can see, this is a reputable site. This is Forbes Health, right? Sorry. And so You said you were in Wisconsin. Ooh. So let me look this up. So if I was to go to, what is Wisconsin? Just go. Now I'll go back because I'm geography. Where is Wisconsin? Yes, you don't see it right here. Finally. Okay. So let me make sure that it's above alert. Thank you. I'm just so seeing it. And this map is now freezing. Come on. Yes, I do want to learn about it. And like that. Okay. Okay, so here's an example. Okay, so what it's saying here is that there are 3 specific counties that there are people who have Medicare Advantage plans, right? So they're tracking this by like ADP, not ADP. What's the other one when you get over? I want to say, anyway, Milwaukee County, Sheboygan County, and Grant County. Now look here, 109,187 people are enrolled in the plan, right? Now, here are the different plans that people are enrolled in. WellCare, right? Aetna, Blue Cross Blue Shield, Humana, Eye Care, My Choice, Wisconsin Network Health, Medicare Advantage Plans, United Healthcare, right? So those are the ones in the state of Wisconsin, okay? Yeah, oh yeah, thank you so much, AARP. It's been a long day. All right, so let me stop sharing. Okay, so essentially you, the home care CEO, you have to go after your license, of course, and enroll individually to these plans. No gatekeeping, because this is what we do over here. You go to provider enrollment. You go to provider enrollment. You either request a contract. Some of them will say you got to send an email, or you complete the application. Complete the application, and you're completing the application for each and every individual company, right? And this is why they want you to, they'll ask you a question. Guess what, guys? They'll ask you a question like, are you accredited? If you're not accredited, just say no. A lot of people get so frozen. Oh, well, right? Just say no. If they only want to work with a company that's accredited, they'll let you know. But if you just don't complete it in general, you'll never know. You'll never know. So, in short, not teaching a class, that's how you enroll with the Medicare Advantage. Now, there are a lot of people who are like medical billers and stuff like that. They'll fill out the application for you, but you can essentially do it yourself. You own a staffing agency. Just look up Medicare Advantage plans. This was a Forbes Health article. Now, what you have to be mindful is that if you look up Medicare Advantage plans and you put, if you go to Google and you say Medicare Advantage plans in Indiana, Medicare Advantage plans in Virginia, Medicare Advantage plans in Wisconsin, that is technically going to bring up the information like you are the senior who is looking for a Medicare Advantage plan. And so you have to sift through that just to get the information you need, which is the name of the companies. And then you go directly to their sites and you apply. Oh, thank you so much, Renita. The spa was supposed to read PSA, but once I got licensed as a PSA in Indiana, do I need to wait for a survey before taking private pay clients? No, you don't. So this is the stuff that some people pay people for, and honestly, the difference when it comes to the credentialing, someone who has gone through credentialing can definitely help you, with the answers on the test, right? But sometimes it is good if you guys go through these applications on your own, because you may not believe it, but if sometimes like the states will say, oh yeah, we're approving people within 90 days, and then a change happens. I was telling somebody earlier today, I said, don't feel pressured, exclamation point. But with everything changing in the Trump administration, by the time you submit your application, the person in that department, the department could have went from 7 people to 3, and now they have hundreds of applications to go through. I said, so be okay that if you decide to wait, and you should, if you need to, that it could take a little bit longer. It could honestly take a little bit longer. And the same thing with these Medicaid applications. Yeah, I was so proud to hear that you guys did it on your own, Renita. When you said you were putting in your application, I said, well, that was really good, because you could have asked me, hey Sean, but you did it on your own. I was really, and it really helped you with learning. Well, why are they asking this? What is this for? I did my Medicaid application for the pediatric program. I did my I share this story every once in a while, but I got a out of network contract with Care First with Blue Cross Blue Shield, and for this pediatric client, and boy, the hours were good. 18 hours a day. And back in 2000, and I got him in 2008. I was getting paid $55 an hour for the RN and $45 an hour for the LPN. And that was good back then. That was some good money, right? But guess what? It took me like 4 months to get paid. It took me 4 months to get paid. Why? Because of the gatekeepers. Because of the gatekeepers that don't want to tell you how to do a bill. So I submitted my claim. I kept submitting my claim, and nothing came back for weeks and weeks and weeks. And then when it finally came back, all it said is, this is incorrect. You have used the wrong code. Now, they're not going to help you out and say, well, you use code ABC, so you really should have used code ABCD. They don't tell you nothing, guys. They don't tell you nothing. And then you'll be like, so if you start out with this help me mentality, And, because I've been on calls with people who be like, I was asking people and they just won't help me. If you start out that way and you don't learn to figure stuff out and problem solve, like how we do in math class, then you're going to, when they just be like, okay, well, maybe you should have. I mean, I remember one time Blue Cross Blue Shield was like, "Are you using a clearinghouse?" AKA, if you use a clearinghouse, they're going to charge you for that invoice, right? So if my invoice was $17,000, they're going to charge me a percentage of that. So either I get charged a percentage, which I already got to pay, take some money out to pay the nurses. So I was like, what am I going to be left with? Thankfully, God, I got nobody else to thank. He was like, call at 7 o'clock in the morning. Call at 7 o'clock in the morning. Do y'all know that somebody picked up and she did not want to share with me the answer, but guess what? She ended up telling me, this is the code you need to use. And I submitted that, and that's when I finally started getting paid. By that time, they had owed me like $46,000 because I was taking care of this client every day. They had owed me that much money. You guys can't make these things up. But thankfully, God showed me how to navigate through that. But I appreciate that I wasn't on. I appreciate that I wasn't waiting for my medical biller to tell me, oh yeah, we're resubmitting the claim, we're doing this, because when you're waiting and you're not involved, you're like, okay, all right, I guess you're gonna follow up next week, okay, but you really don't know what's going on. You don't have that you don't know that, that they got sent to multiple people. It's a lot of things you don't know. Yeah. These applications are growing pains of the business. You learn a lot doing it yourself. Yes. And that's why I wanted to talk about, I'll just give, since I already shared this one story, I'll just share two more stories. And so that was my experience with Blue Cross Blue Shield. And after that, the money just was flowing. And I didn't have any more problems with the billing, right? So, also, like, I have people now who are trying to get credentialed. And just so you know, what does that mean? You get licensed first, and then you get credentialed, right? So credentialing is like your Medicaid Advantage, your Medicaid waivers, your MCOs, your private insurance. That's you applying to these places so that your home health care business can have other forms of reimbursement. Other than that, the only form you have is private pay. Now, I love private pay all day, but I do believe in a good mix. And they call it a mix, basically a mix of payers. That's what that means. You want to have a good mix, a mix of payers. You want to have VA money. You want to have private pay money. You want to have Medicaid money. You want to have supplemental insurance, right? I go over that in my book, 15 Ways to Get Paid in Your Home Care Business. You can check that out. But with that being said, I had an inkling for some reason. It wasn't even something that my mentor had shared with me. I was like, maybe what I'm in the DMV, maybe I should apply to get some VA clients, right? I don't even know where that idea came from. I literally had to go search and find the application, right? Like I said, there's some things that my mentor told me, and there's some things that she didn't tell me, but I could bring to her and be like, what does this mean, right? So I found the application all by myself. I completed it all by myself. And all by myself, my application got rejected. And it took them 12 months to send me a notice, right? And I was like, rejected. Now, at this point, I had not received any rejection. I got approved through Medicaid, my the pediatric waiver, which was one of the hardest ones. I got approved through Blue Cross Blue Shield when everybody else said, "Oh, we got every insurance but Blue Cross Blue Shield." So I was, receiving all these acceptance. So to get the rejection from the VA, I was kind of confused. But something told me I wasn't at peace with this decision, right? You know, that's a word we use when you're not settled. Like you said, my spirit is not at peace with this, right? I'm not at peace. So I said, is there an appeal process? I literally just asked that. My own, you know, I don't even think I was 30 yet. I asked, is there an appeal process? And they said yes. And so then I found some information, which was they have rejected me because I was not Medicare certified. So a part of their approval is that you have to be Medicare certified, which I was like, duh, well, this is the VA, so this is federal funds, right? So, and it does help to know like how they get paid is how they would pay you. So in short, I said, well, the reason why I'm not Medicare certified is because I only serve the pediatric community. And they said, oh, so you serve the pediatric community? I said, yeah, I only serve individuals that's 21 and younger. So they literally waived their policy for me having to be Medicare certified. And I was able to, and they wrote pediatric only on my license, or I'm sorry, on my provider agreement. So as long as the person was under 21, I could bill for them. And there were several active duty who had special needs medically fragile children. And so that's how I got my foot in the door. And it took a total of 18 months to get approved. Some of you guys would have thrown in the towel, been complaining, this don't work. They said, you know, why even start this business? This don't work. You guys will complain about the things you do for your own business, yet you're working a job that you got to do all of these things just to get a $2 raise or just to get a 3% raise. And you complain about doing it for your business. You don't really want to do the work. You don't really want to build a legacy. That's what I'd be thinking. I'd be like, do you really want to build a legacy? Because the way you complain about doing stuff for your own business, if it's in your own name, you act like it should be easy. It should just be, why are they making it so hard? Yet, if your boss say do X, Y, Z, and you ain't getting any extra pay, boom, you on it. You should say, not anymore. I have home care services. What services? I have home care service. What service you have, please? I'm not sure. Hey, Lily, I believe I'm pronouncing it right. I'm sorry, I'm just not seeing your message. Yep, you definitely wanted to learn. Thank you for sharing the live. I'm just seeing some of your messages. That was a lot of money. Yes, it was a lot of money. And it was a big mess. And so with some of you who were like, I was still working one of my part-time jobs, and thankfully so, because I needed to pay my rent. I lived in DC at the time. I lived in this area called Capitol Hill. And I was like, I could not do that. And so this was not I had to figure it out. And thank God I did figure it out. I clocked you. Yeah. I just it just is something that I keep seeing. So I keep seeing and keep hearing, and now I'm at the point where I just let some people talk. Like if you want, I'm like if they start talking themselves out of the idea that they said that God gave them, and I'm like, oh, but what about this or what about this? I'll start asking questions. So why do you feel that way? So why do you think that? And the more they talk, I'll say, okay, can I pull out? I'll ask myself, can I pull this person back, or are they too far into this mindset? I'll ask myself. Mm-hmm. So here's my last example. Again, call from today. Call from today. Again, these are the common pitfalls that you want to avoid. So call from today. Spoke to a lovely, lovely, lovely person, lady in Arizona, right? So she has some meat in the game. She has a background in the healthcare industry, not as a nurse. She told me she should have been a care coordinator. And she was saying, well, Sean, I just need help with marketing. I need help with marketing. Arizona is a non-regulated state, and I've done this, and I need help with marketing. So do you have any suggestions, any recommendations? And the first thing I'm thinking when she said that, I'm like, well, haven't you been on any of my lives? Like, I'm always giving you guys free advice about marketing. And then I'm like, we got marketing trainings. I'm like, so you want me to give you a specific recommendation? And so again, I'm listening. And I said, well, first, can you tell me what you have done? And she said, well, I've passed out flyers. I've gone to doctor's offices. And I said, oh, okay. All right. And I quickly, the spirit discernment picked up something. I said, oh, her previous role is preventing her from doing her marketing, right? And so then I began to ask her questions, and I said, well, and because she told me she was following up, and I said, okay, that's good. That's it, because most people don't follow up. And she said, yeah, I was following up. I said, well, when did you follow up? And she said, I waited a month. And I said, a month? You waited a month to follow up? And she said, well, yeah. I said, a lot can happen in a month. A whole lot. She was like, well, you're right. And then she has people that she had worked with, like nurse practitioners, other care coordinators, and it just seems like she was doing some marketing activities, but did not have a marketing plan. Now, I've brought this up before in previous lives. Guys, you can do the act of marketing. This is what I mean by the act. I'm going to go pass off 100 flyers today. I just posted on social media. I talked to somebody about my business. Those are actions. Those are activities. But without a plan, these are not being done in a systematic way, right? It's not being done in a systematic way for you to be able to get results and track results, right? Get results and track results. The plan says, and I think I've used this example when during the election, the plan could be to win the presidency. The campaign, right? Because you have a marketing plan and then you have a marketing campaign. The campaign is, I'm a Democrat. I'm going to go to all of the states that voted blue. That's it, right? And then go back to the plan. Okay, this is the plan is our message should be, boom, boom, boom. Why? Because in that plan, we want a message right? A message that speaks to our ideal client, ideal customer, right? Okay, that's in the plan. So then in the campaign, you're carrying it out. You're going to, the campaign says, go to this specific location. All right. Use that language from the plan, right? Now track your results. Okay. All right. In the plan, you were supposed to go to this senior event. Did you go? Did you go? Did you meet with those people? Did you say those 3 things? Yes or no? Okay, carry on with the plan. Okay. All right. So we mastered that one. We got 40 people from there. Boom. Keep moving on. So the plan has the strategy. It has the strategy. And if you don't have the plan with the strategy, you can show up to the same the event as the person with the plan, do some activities, get some results, but then it will be a, you know how like they have those songs and it's like, this song is good. And that's the only song that they're ever known for. It's a one-hit wonder. And you can't even like, well, what do we do to get, these 3 clients from this event? You don't know because you didn't have a plan. You don't know because the strategy wasn't there for you to track, for you to identify, oh, when we do this, this is what happens. And any agency that wants to eventually scale has to have a marketing plan. Any agency that wants to scale has to say, we have a systematic way that we get clients all the time. So what happened with her is that I just told her, I said, well, I need to speak to you as a mentor, even though you're not my mentee technically, but you watch me online. I said, you don't have a plan. And until you have a plan, I can tell you some things to do and you will do it, but it's not going to necessarily work for you because you don't have a systematic way to carry it out. And also, she was being a little bit too passive when it comes to her marketing. And how I described it to her is, you're not marketing, you're sharing. Because a lot of the people she knew, she was just like, well, it's just like if I say, hey guys, yeah, I'm using this new Korean skin, what you call it? That was a weird thing that TikTok was helping me do. I'm using this Korean skin toner. It's supposed to help with a natural glow. I'm sharing the information with you. But if I go and I say, wow, this is a Korean, did you know it has this ingredient in it that's supposed to help with fine lines? And then it also is supposed to, help with hyperpigmentation. It's supposed to help with acne scars, even if you have cystic acne. And then people have seen results as early as 2 weeks of using it. I have now just marketed the toner. But when I was just sharing it, I just said, oh, this is nice. Everybody's talking about Korean skincare products. Oh, yeah, thank you. Yeah, they do. But now I have to sell it. I have to market it. So then it makes you want more. You want more. Well, tell me more about it. Okay, because you just pointed out some things that I might need. I might need to remove fine lines. I might need help with cystic acne, right? So another common, so the first common pitfall from my call earlier today is that if you are a skilled agency and you don't know what forms to use in your initial assessment, it can not only make you fail a survey, but you would be so much out of compliance that you could possibly get fined, right? Because even if you're not in a situation where they're going to be surveying you right away and they randomly choose that file and they see that those things are missing, then you will be out of compliance. So it's best to know your client care or clinical policies and make sure you're always in compliance. So avoid that pitfall. Second pitfall that we talked about tonight is getting out of the habit of wanting everybody to do everything for you, and feeling like this woe is me kind of thing, where if somebody doesn't help you, how are you going to succeed? You're going to succeed because you're going to figure it out, right? You're going to succeed because you're going to figure it out. And even if it takes you longer to figure it out, you're going to succeed because you're going to figure it out, because that is what business owners do. Our superpower is that we figure things out. We are problem solvers. That is actually, to me, I've always felt like a home, not only home care business owners, but entrepreneurs and business owners, our superpower is that we're problem solvers. We're really good problem solvers. So I pray that you receive that today. And then the third is that whether you are starting your home care business or you're already in business, that you really you avoid, the third common pitfall is you avoid marketing without a plan. Avoid marketing without a plan. Come up with a plan. If you don't know how to do that, then just start doing some research. I am trying to figure out the date. I do want to have a spring marketing challenge for home care business owners. I'm trying to figure out if I'm going to do it in a 1 week where we do like 4 consecutive classes, or if I'm going to do it over a period of 3 weeks on a Thursday, because Thursdays are a good day for me, right? And because there are a lot of things going on this month, and this kind of seals the deal before summer, the summertime. And I got to tell you guys, summer marketing is slow, but we still got to do it. So, Lovecraft, I'm about to get another job so that I can be mentored by you. Oh, oh, thanks. Okay. How do you contact me? In Washington, go to my website, www.savvybusinesschick.com, and you can click the link for inquiry, or email me at mentor@savvybusinesschick.com. I'm about to get ready to get off. Girl, this home care stuff is time consuming. You are absolutely right. It is time consuming. But guess what? It's only for a short period of time. It's going to be like that. It's only for a short period of time that it's going to consume most of your time. And then freedom. It really is. So if you can invest in your business, even with the shows coming on, even with the concerts coming out, even with the summer coming up, if you can invest, I work on my vacations. If you can invest in your business, it is a lot of work. It is time consuming, but it is so worth it, guys. It is so worth it. And when I say freedom, when the year I hired an administrator, I always said that's the year I went on 4 vacations. I went on 4 vacations that year. I went to China. I went to Hawaii. I went to Israel, and I think I went some random place like St. Thomas. Peace. I was out. Y'all call me. Okay, payroll done. Okay, good. No problems. Okay, that's good. I built that. I put in my time, and then I was able to be out of the office. That's why I always say your aspiration as a CEO. Because the CEO doesn't go in the office. Man, getting away from the office was the best thing I could ever do. Okay, guys, I do have to go. Been waiting for your approval letter for almost 2 weeks. Oh, it's gonna come. 2 weeks. That's that's not long at all. You just cut down your hours of the job to focus on. Okay, let's get on a call or Zoom soon, Bernita. Oh, we did speak today. Why did I know it was you? You're welcome. Waiting 2 weeks for an approval letter is insane. It's really not. That's a really short time. Why do you think that's a long time? That's I don't know what state you're in, but that is not. Okay. All right, guys. Well, I'm glad I was able to get on tonight. I'm glad I was able to get on tonight. Hope this blessed you guys. And yeah. Uh, please, I have not been good with my DMs. So if you're trying to DM me, don't. We're going to get caught up this weekend. It'll be better if you email me at mentor, mentor, at savvybusinesschick.com. Right? We have a lot of people that just got approved for their license, and we got people that are in our spring home care Kickstarter program. We busy. We busy. We trying to get people who are action takers, right? So, all right. Love you guys. Have a good night. You're more than welcome.